Well, good afternoon, everyone, and welcome to this week's coaching room. I was not here for a few weeks, and we had Jeff and Julie and Mark and Libby in helping out. So I want to say a big thank you to them for filling in with me when I could not be here. But I'm so excited and happy to be back with you all on this Tuesday, March 14th afternoon. Welcome back to those of you who are my usual coaching roomies. And for those of you that have not been here before, welcome. I'm glad you found us. The coaching room has that format that we've all come to know and love, that we will certainly have an hour for our conversation today. If that conversation takes an hour, then we will use the whole hour. But if that conversation takes less than an hour, then we will stop as soon as we've answered all questions and give everybody back the time that's left. So sometimes our coaching rooms last 15 minutes, sometimes they last an hour. It just sort of depends on the conversation and the topic. I had a little bit of an emergency with the site before I got on this call, hence I might be starting a couple of minutes late, but I just hung up the phone at 2:59. So thank you for being patient with me in the event that I had to be a little bit tardy today. So how we ask questions, we are on our Zoom format now. You can ask questions by going to the Q&A portion in your control settings and clicking on that double quote, or the double box where it says Q&A and type your question in there. I do know sometimes they get put into the chat, so no worries, I'll be monitoring both. Just easier for me to track the questions over in the Q&A section. So if you could try to put them there, I would be much appreciated. Today, we are going to talk about the end of the public health emergency, which is coming up in the next couple of months. So March 11th of 2020, the public health emergency was announced. And now, as of May 11th, 2023, the public health emergency will end. So it's been a long 3+ years, and it's been a lot for everyone to go through. So we do want to talk a little bit about what's going to be happening as the public health emergency sunsets, because there were some things put into place during that period of time that affected our operations and impacted what we needed to do and how we needed to move forward. So we are talking largely to nursing home providers today. So assisted living folks, hang with me, because certainly when we're done, if you've got questions about stuff that has nothing to do with the waivers and the interim rules and the ending of the public health emergency, you can ask any question that you want. Does not have to do with today's subject matter, and we will try to get those answers to you. If I'm not the right person to answer that, or I don't know the answer, then I will try to get you the answer or get you to the right person to answer your question. So with that, we'll get started on content for today. The Centers for Medicare and Medicaid Services implemented some interim final rules at different points in 2020 and 2021 to establish requirements for certain things. We also had regulatory waivers that were in place and some things with Medicaid determinations. So I'm going to focus mostly on the interim final rule information today and the regulatory waivers, because that's the content that I think is coming up with the most questions that I've seen happening. So those interim final rules established requirements for COVID-19 reporting, COVID-19 testing, vaccines and education, and a staff vaccine mandate for our nursing homes. For the COVID-19 reporting requirements, nursing homes are currently required to report specific data to the CDC through the National Healthcare and Safety Network, or NHSN. These pieces of information help measure COVID, the impact COVID's had on nursing homes, the impact COVID's had on our staff, our residents, and our operations. And there were also some enforcement mechanisms established, and I'm not going to concentrate mostly on those, because really what we want to take into consideration is what happens after the PHE ends, or the public health emergency ends, on May 11th. So nursing homes will have to continue to report their COVID-19 data that we're reporting now through NHSN. We have to continue to notify residents and families of COVID-19 infections in our communities through December 31st of 2024, unless there's a change, unless CMS takes regulatory action to put something permanent into rules. But right now, we need to continue to make that data report to NHSN and make sure residents and families are aware of any COVID infections that are in our building through December of next year, 2024. The reporting of our COVID-19 vaccination status also would continue through May of 2024. So not December, but May of 2024, unless CMS does something to change that requirement. So that has to do with reporting requirements for infections and resident vaccines. As far as testing requirements go, we continue to have documentation from CDC that recommends nursing homes should follow the regular standards for infection prevention and control, and they will be subject to following CDC recommendations as they move forward. So there won't be anything that changes in testing because CMS always defaults back to, we need to continue to follow and look at the CDC requirements for testing of staff. And that has been actually what the Minnesota Department of Health has been following for our surveys throughout most of the pandemic. So we should continue to follow those CDC testing requirements. And if the CDC testing requirements or other requirements change, then we would be talking about a potential change to our practice. I've had a lot of people ask me what I think is going to happen in terms of masking, eye protection, and some of these other infection prevention and control practices into the future. And I don't know. I don't know what my prediction rate has been throughout the pandemic. God, I don't even think I want to know. But I do think that there is a possibility that when the public health emergency ends on May 11th, we may see some changes to CDC guidance, but we'll find that out as we get closer to May 11th. So stay tuned. And as I have those CDC recommendations change or as things come to our attention, we absolutely at Leading Age Minnesota will get that information out to you. The staff vaccination mandate requires staff, volunteers, and those regularly scheduled volunteers in most nursing homes that are Medicare, Medicaid certified. And we require those vaccinations to be completed, including that primary series, or have an approved exemption that is either a medical exemption or a religious exemption. This continues to remain in effect, and we don't think that this is going to change. We're not really sure what's going to happen at this point, but right now we know that all of the staff have to continue to have those vaccine mandates. We know there have been court challenges and there have been other things happening. We also know that the CDC's VRBPAC committee and the FDA VRBPAC committee has been meeting to talk about what really are the vaccine recommendations. So for now, we'll continue with the same vaccine mandate that we've had, but I think that there is an expectation that there'll be some pretty significant work done on this in the coming year. So we could expect changes to the rule to maintain relevance with that, but we'll see as those move on. But right now, we'll continue to move forward as we have been. So before we get to the regulatory waivers, there's a question over in the Q&A box, and it says, have you heard anything about whether or not we'll still be required to follow the transmission rates? They're still following those to help determine masking for their sites. I have not heard that there are going to be any changes. I really don't know if after the public health emergency ends on May 11th, if the CDC will change their recommendations in that area. I'm checking their sites daily, sometimes 2 times a day. And of course, we are involved in multiple discussions with state and federal agencies through Leading Age Minnesota. And as I hear those things, we will absolutely, or others on my team hear those things, we will absolutely be bringing them to you so that you have some information with which to move forward. But right now, we haven't heard anything concrete. So those are the interim rules that were put into place for reporting, testing, vaccination. We also know that there were some education requirements that came around during that period of time. And we do need to continue to educate residents and staff and visitors to continue to offer those COVID-19 vaccines to staff and residents. And we will need to be able to do that beyond the public health emergency as part of our requirements of participation through May of 2024. And then if there's anything that changes from that, we will hear. So right now, what it's looking like is everything that we're doing currently needs to be followed through May of 2024, with the exception of the reporting requirements to NHSN and notification of infections in the building. And that needs to go through, NHSN information that needs to go through December 31st of 2024. So May or December, depending upon which one we're looking at. The next question that we have is, have you heard if any tests will be available for COVID testing of staff and residents after the PHE has ended? I know that they are working on that and working to see and make sure that tests are still available. I know that the Minnesota Department of Health is working to try to secure some grant dollars to continue to provide and offer those tests. I don't know to what extent we'll be able to do that or those will be available to us at this point, but we will be watching that and keeping an ear out, but I'm not sure yet. They're working on it though. I do know that they have remained committed to do that. If you are a Leading Age National member, they do have some tests that are available to be requested through Leading Age National. Certainly if you'd like that information, you can get that out to me and I can give that to you. Otherwise, we'll keep an eye out for what's going to happen with those. So interim final rule requirements. And then of course we have the regulatory waivers that are set to expire with the public health emergency. We expect that if there are any changes or transition plans for these, that CMS will be communicating with us, but most of these waivers are going to expire on May 11th. So telehealth requirements, those actually are going to be continued flexibilities through December 31st. Telehealth really doesn't have too very much to do with us, with the exception of we may have physicians or other outside skilled services being offered through that telehealth program, and they will still be able to bill for those. So we may have some ongoing telehealth availabilities to us, depending upon who's offering them and if they're able to continue to bill. The nurse aid training waiver, that one was terminated back in June of 2022, but we've had really significant trouble and backlogs when we're looking at background checks, training, and testing. And that's just not with Minnesota, that is across the nation. So CMS made additional waivers available to states, and Minnesota does have a continued waiver. So we do have that in place, and there has been a bill introduced to the House that we're hoping will provide some additional relief to that. There is an Advantage article that goes through the statewide waiver, and I will put that hyperlink over in the chat for you. So if you want to go back and familiarize yourself on all of the nurse aid training stuff, and there's a ton of it, I can put that link in for you as soon as we get done with this content part of the coaching room. All right. The qualifying 3-day hospital stay is still in effect, but that also ends on May 11th with the rest of the regulatory waivers, the 1135 waivers. However, there are some national advocacy efforts taking place in an attempt to try to do away with the 3-day stay, qualifying hospital stay requirement. We are seeing people discharged so much more quickly if they're able to, and that 3-day hospital stay waiver just is turning out to be very antiquated and hasn't really kept up with medicine and how often or soon we're able to discharge people post surgery or post other treatment from hospitals. So Leading Age Minnesota and Leading Age has shared the action alert for Leading Age National to please take some action to try to eliminate that 3-day hospital stay waiver completely. And I can absolutely put some information about that in the chat when I'm done going through these. So I've had a lot of questions lately about the 3-day hospital stay waiver. So it is indeed still in effect and it remains in effect until May 11th. But let's take advantage of some of the action alerts we have and really try to petition the federal government to get away and do away with that 3-day stay waiver, because it's not doing us or our residents any good at this point. All right. There is some information on the pre-admission screening for residents. We will be going back to the regular way that we do that. I've had a lot of questions on resident roommates and groupings. So we were able to do this without providing all of that advanced notice to residents that we used to have to provide. And then some of that waiver ended. However, we do know that we need to continue to group our residents or cohort them based upon COVID-19 and whether or not they're affected. So we still have the right to choose to cohort residents and put residents into those groupings when they are COVID positive. So dealing with that. we should continue to effectively do that. But we do have to continue to try to preserve the residents' right to choose roommates and refuse relocation. Now, that will certainly be dependent upon a whole bunch of factors, like what is the extent of the outbreak in your building? What do we have for infectious rates? Is moving them something that we need to do? Do we have roommates that are involved in the equation? Because some of us still have rooms that have residents who have roommates, and some of us have a little bit more option to private rooms, and we're all a little bit different. So that will be something that we have to start making sure that we're taking into consideration resident choice and all of those things, but we still are going to be required to try to do some cohorting when the assessment of the organization deems that it is necessary. So just keep an eye on some of that. And then for resident transfer and discharges, we had the ability to transfer residents to other facilities or other things, especially when we were standing up COVID-only facilities, things like that. But that has been changing over time. I don't know that that's something that we're still actively practicing. So we have to continue to do our mitigation strategies, just like with everything else. But we do have to now be complying with our transfer, discharge, and relocation requirements, including that advanced notice that we've had to do in the past. So we talked about some of the vaccine test and treatment supplies. And so we're continuing to look and see what CMS and the state are going to do with those. I don't have a lot of new information with that available for you today, but certainly we will continue to keep that on the forefront of what we're talking about, advocating for, and reading on, and we will get that information to you when we have it. All right, so we've had a couple of questions over in the chat. I don't know if you've got more questions either on the 1135 waivers or some of the interim final rule information, but certainly pop those over in the questions, or if you got questions about other stuff that doesn't have anything to do with any of the stuff that we're talking about, certainly happy to take those too. In the meantime, I will put an Advantage article to the nursing assistant information over into the chat, as I said that I would. And then I will also pull up some information that we have on our advocacy efforts to get rid of the 3-day qualifying hospital stay over in the chat as well. So I will just pause there for a minute to see if we've got any more questions being added. All right, I'm not seeing anything with that. So while we finish up what we're doing, I will just pull up the next slide. The next slide has our expert support team on here. So anyone that needs assistance, we're here for you, however we can help. Up on the screen, I have Jeff Bostic. He's our money and information guy. His information up there, including his email and phone number, is available for you should you need anything in those areas. Bobby Guidry does all things home and community-based services for us. Mark Schulz is our legal guy and deals with a lot of our policy issues. And I'm Kari Everson, our clinical and operations person. So if you've got clinical questions, operations questions, I'm certainly here to help. You can reach out to whomever on our team you are most comfortable working with. We know that some of us have developed some really good relationships with many of you. So if there's someone particular that you want to talk to, please absolutely go ahead and reach out. Or if you want to, you don't know who you want to talk to, you can certainly reach out to us depending upon our subject matter expertise, and we will get you to the right person if we are not the right person. So, all right. I think that that's all I have for everyone today. I'm just going to wait a couple of more minutes to see if anything pops into the questions, because sometimes people put those in as after everyone else is done because they feel like that's the time. So I'm just going to do a little 10-second pause here. And if nothing, then we'll have a great afternoon and I'll let you go. So here we go. I'm going to wait 10 seconds and see if we've got more questions. Okay, we've got a question over there that says, do you think we still have to have a separate COVID policy, or can we start incorporating all of that into our other policies? I think that you can do whichever one feels most comfortable to you. We know that COVID has been really difficult, and sometimes people get confused if those policies are linked into other policies. Um, Otherwise, I think you certainly can put those in with your other policies and maybe just add some COVID specific information. I don't think that there's a reason to have two separate sets. I think whatever is easiest for you and the people in your organization to reference and get information fastest is what you should do. You can do either or, and you can do it now, or you can do it when the PHE ends. It just doesn't, at this point, it doesn't matter. Whatever is most comfortable to you. You're not required to have separate. Okay. Well, that's all I'm seeing from everyone today. Thank you so much for being here with me today on Tuesday afternoon. It's always nice to be able to get together and have conversations with you guys. If there's anything I can do for you in the meantime, please don't hesitate to email, call, text, whatever it is that you need. And I'm happy to help wherever I can. I hope you have a great rest of your week, and we'll talk to you next week. Thanks much. Bye-bye.